It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, thanks for joining us, folks. We're here at the 26 Station Circle. It's part of the Lehigh Valley Health Network. This place is absolutely fantastic, and we're going to be interviewing some doctors. And I want to thank you for the great response we're having. I appreciate the fact that when you see Debbie and I, you'll come up and thank us for having the doctors on and bringing you up to date on what's happening in the medical field. As I've said, Lehigh Valley Health Network is second to none. Today I'm excited to interview the people that are here. A very good friend of mine, Dr. Falvello is here, Megan Ferderber, and also Ashley Dalberto. We'll get to them in a second. Anthony, how are you?
I'm doing well. How are you?
Good. You're looking good.
Thanks.
Okay, well,
yeah, thank you.
Well, I think I'm, 4 years older than you, I think, right? Yeah.
About that. I think 4.5.
4.5, yeah.
Yeah.
Hey, I got to tell you a story. Talking to my good friend Mark yesterday. He lives in Pittsburgh. So he's been having problems with his hip for a long time. Long story short, he says, I'm going to get this special surgery done. Mm-hmm. Okay, right here in Pittsburgh. I said, it's anterior hip replacement. Mm-hmm. Oh, I said, how special is that? So yeah. I said, well, my good friend, Dr. Anthony Falvello, has been doing anterior hip replacement how long?
8 years.
8 years.
Yeah, since 2015.
Now that's, when he explained it to me, explained the difference between a regular hip replacement and anterior hip replacement. It's pretty big.
There is a big difference, yeah. The traditional hip replacement, the incision is on the buttock, and you have to go through the muscles of the buttock to get to the hip joint in order to perform the replacement. But with an anterior replacement, we make an incision in the skin and we go between the muscles on the front of the hip to perform the hip replacement. So we cut very little muscle. It has a lot of advantages for the patient and also for the surgeon.
Wow. Well, he was excited. He says, yeah. I said, absolutely. I said, Lehigh Valley. So tell me about this place here.
Yeah, so this is Station Circle. We're located at the Humboldt Industrial Park. We have our Orthopedic Institute is here, the Lehigh Valley Orthopedic Institute. We just ranked 27th in the nation for orthopedics by U.S. News and World Report. We're very proud of that. And under this roof, we have a lot of subdivisions and specialties here. Dr. Ferderber joined us recently. She's been a great asset here. She performs injection procedures and ultrasound-guided procedures, and also treats orthopedics in a non-surgical manner. We have multiple orthopedic surgeons here, different subspecialties of orthopedics. So we have hand specialists, we have sports specialists, we have joint replacement specialists. We have podiatry here, we have rheumatology here, we have physical therapy here, we have x-ray imaging here. We have so many assets here, and the newest one being our walk-in clinic. The walk-in clinic is a huge advantage. If you twist your ankle or fall on your wrist or having issues with an orthopedic problem, and you go to the ER, you could end up waiting for a long time because typically orthopedic problems aren't a priority. Heart attacks are a priority, strokes are a priority. And unfortunately, the orthopedic patients can wait for quite a long time while they're dealing with more critical patients. But here, you can walk in to our clinic Monday through Friday, 8 a.m. to 5 p.m., I believe, and be seen for an orthopedic issue and get the treatment and care you need and be on your way home.
Amazing.
Yeah.
What are some of the types of patients you normally see?
I focus primarily on joint replacement. I also do orthopedic trauma, but I do also do general orthopedics like rotator cuffs and things of that nature. But my specialties are anterior hip replacement, which again we discussed is a muscle sparing approach and it provides a patient with a faster recovery. But I also specialize in robotic knee replacement, and we perform many robotic knee replacements, which is a very patient-specific approach. It's a newer technology that helps us fill the space between the top and bottom bones in the knee very precisely and account for each patient's unique variations in anatomy when we do so, which is not something that traditional knee replacement could offer.
Tammy was telling me about the machine or the robotic units. Is it Velis or something like that?
The one we're using here is the Velis. It's by Diffusion.
So what's so special about this machine?
The machine, it lets us test the range of motion of the knee in real time. We actually, once we set the machine up during surgery, we take the knee from full extension or straight to full flexion, meaning bending backwards at the knee, and we get a graph. And it tells us how the patient's knee is functioning through each little movement in range of motion. And then we can take that information, adjust our positioning of the knee replacement specific to the patient's own anatomy, and then try to reproduce their pre-arthritic knee very specifically. And the big advantage is we don't have to do as much what we call ligament releasing and ligament balancing. So a lot of times there's a lot of less soft tissue dissection, and that also can afford a patient a quicker recovery.
I always, when we started, I remember a while back, we did a show up at the Lehigh Valley Hospital, Hazleton, on the robotic machine that was there. I don't think this machine was there at that time.
I'm not sure if we were there that time, but it is new. We got it not this November, but November of 22, and we've done over 100 robotic knee replacements right here in Hazleton.
Wow.
Since that time. And my patients are loving it.
Yeah. Always was concerned about robotics, saying, how do you know if you slip up,
Yeah.
So you really have to be trained to do that, right?
You do. I did get special certification to learn how to do it. Unlike the robot that general surgeons use, the orthopedic robot is more like a robotic arm that you would see on an assembly line, and we control the arm. So the surgeon remains scrubbed. We're not operating a controller in a different part of the room like they are with a Da Vinci or other machines. We typically are in control of the robot the whole time.
How do you know whether a patient you would use a robotic versus doing it physically?
I use it for everybody.
You do?
Yeah, 100%. Unless there's a issue, we had one incident where, we had to do a few the more traditional way because the robot had a software issue, but that's one day out of, I don't know how many. It's been very reliable, and I find it to be a very useful tool.
People, hold off, and it's like knee replacements. I'll take this and such, and then they wait till it's really bad, and then that's when they do surgery. How do you know when you have to make that move?
Well, actually, I think Dr. Ferderber can comment on that because she sends them to me when they're ready for that.
Okay.
So
right.
I'll let her.
Well, you're on hold right now.
I'm on hold. Okay. Yeah, that's right.
I like the name Ferderber.
Yeah, it's a wonderful name, right?
Yeah, it's Ferderber, Dr. Megan Ferderber. Well, now, okay, tell me a little bit about yourself before we get into the specifics.
Yeah, sure thing. So I'm an Army brat. I kind of was born and raised moving around the East Coast of the country here. Really learned about discipline, really learned about making friends very easily too.
Yeah.
And I think that's really helped out in my career currently. Went to Penn State for medical school, went to University of Pittsburgh for residency and fellowship in sports medicine, and after spending my first 5.5 years out of fellowship training as academic faculty at East Carolina University in sports medicine, I'm back home. I'm back here in Pennsylvania.
Yeah.
And it's been a big transition from academic medicine to coming up here, but I love it. It's been wonderful. It's been a great transition. I love my practice. I love what we're building here, and I like being able to, help out my neighbors.
Okay, so let me go back. Why did you decide you wanted to go into medicine and become a doctor?
Oh man, so medicine really has been something, it's actually very interesting. Nobody else in my family was a physician at the time I decided on this. I really just love helping people with their health, and I think I always liked being the person to help somebody whenever they're at their most vulnerable. So our patients who come to see us, they're very vulnerable at that time. They have pain, they're not functioning appropriately. They want help with both of those things. They want optimization of their function, and they want minimalization of their pain. And I just really like being one of the folks who can help with that.
How come sports medicine?
Sports medicine, so I have a little bit of a background in sports, but not only that, I have a very athletic family.
Oh, do you?
Yes, I do. So my sister was a very elite gymnast. I'm now very proud of her too still because she's in the U.S. Army. She's an officer, and she's a Black Hawk pilot, so I'm very proud of her. Wow. My little brother was a very good football player. He's now a sports medicine physician as well up at Mount Nittany Medical Center. My dad, ex-military, he's now doing I got to be honest, these military guys, they're super active, right? Even in retirement. My dad now post having a hip replacement, he's actually in the process of likely getting another one on the other side, is very active still. And I love giving him guidance on how to stay active as he's hitting his upper 60s. He's going to be hitting 70. And he's still calling me, asking me for advice on, hey, I think I have tennis elbow now. What are the exercises I should do? What should I do to really take care of this so I can go back on my bike can go for my 20-mile bike ride. So I like being able to help all my folks who, not only family members, but patients who want to be active. And I kind of know the mindset of the athlete, being a former collegiate athlete myself. And I'm saying all this, I know I'm talking more about athletes and folks who are these, really elite, physically active individuals.
How about lazy guys like me?
I was just about to say, for not lazy
Sammy's
guys
coming into the picture
necessarily.
now, my friends, okay?
But truly.
Athletic sports, like this.
Yeah.
But the guys like me, yeah.
So
Come on, give me a
So I
break.
know even though my title and my training is called sports medicine, not everybody I take care of is involved in an organized sport.
Yeah.
I'll take care of those grandparents who really just want to, be able to get on the ground with their grandkids, be able to go for a walk, be able to stay active in some way. So you don't have to be an athlete for us to take care of you in sports medicine.
I'm going to get to that in a point, but I want to ask you a question.
Sure.
You're young, you're very intelligent. Why did you decide to come to Lehigh Valley in the Lehigh Valley Health Network?
Honestly, I was tired of being away from home.
Okay.
Yeah, so again, being from Pennsylvania and also after having spent 5+ years in North Carolina, which, don't get me wrong, I loved the warm weather. I really did enjoy my patients down there, my practice down there. But it's tough to have to drive 10 hours every holiday to come up and be with family and to celebrate with friends and whatnot. So that was really the big reason why we decided to move back up here. And Lehigh Valley really did offer us great opportunities to really grow and build our practices.
They've been doing fabulous in this. They've just been doing fabulous. Now let's get back to your work, okay?
Sure. Yes.
We were talking. How do you know? First of all, people are always nervous about surgeries. Okay, so let's talk about you having either hip pain, knee pain, whatever kind of pain. How long do you go before they come and see Dr. Ferderber?
So a lot of times it's usually more at the onset of the pain, to the point where the patient's saying, hey, I've been having this pain now. It's, I'm noticing it more whenever I'm going on my walks. It's keeping me from doing some of those more advanced activities that I typically like to do. So I'll give an example of, let's say, hip arthritis. So if somebody comes in and they say, hey, I'm starting to feel those twinges in my hips. Certain movements are really starting to aggravate me a bit. It's not too bad that I can't walk, that I can't function daily, but it's uncomfortable. So that's usually whenever they come and they see me. I do the initial evaluation, I do my exam, I walk them through some of their treatment options at that time. And of course, as a sports medicine physician, I optimize non-surgical management until sometimes we get to a point where we do need somebody like Dr. Falvello to come and stand in and help them out with something like a hip replacement. So types of treatments I'll offer them. Physical therapy, we work very well with our physical therapy partners, and they do a tremendous job with our patients. We additionally will offer them things like injections. So one of my other specialties, not only in sports medicine, is ultrasound guided procedures. So I will do a lot of ultrasound guided injections for patients who are appropriate and need them.
Now, you decide when the patient is ready for Dr. Falvello for the surgery.
So that's a good question.
You put a sad face on. You should be happy.
I put a little bit of a sad face on.
Good news for you, Mr. Lesante. They're going to be operating on your hip, okay, and you're going to feel better.
I put a little bit of a sad face on, but I'll clarify that a little bit. I never make the decision. It is always a shared decision with our patients.
Yes.
It is always, because I don't think any of us could ever know fully the pain that our patient's going through, the discomfort on a day-to-day basis. So it really ends up being a nice discussion with them. We talk about things that we've tried already to help them with their pain and their function. And if really non-surgically, we can't get them to the point where their day-to-day activity is satisfactory for them, that they're able to get down on the ground with their kids, that they're able to go on those walks. They're to the point where they're feeling pain at nighttime. They turn and they feel it. That's when we say, okay, here are the non-surgical treatments. Do you think at this point we may need to consider something surgical? And if so, we talk about a conversation with one of our surgeons.
And I think once you're in that pain, in your constant pain, it's like, we got to do something about this, okay? But I had a friend of mine who had knee problems, okay? And he was always, and he couldn't walk from here to there without his pain. I said, well, go and see, they've got tons of great orthopedics. no, I'm going to wait. I'm going to wait. So after 5 years, he finally went. So that's when my question was, when do you know, okay, after your, analysis, or you're looking at when do you know it's about time? Should you do it sooner, later, or when?
It's all very very individualized.
Yeah. Can't you tell when someone comes in who's really has some serious problem with the hip, or can't you tell right off the bat we're going to need surgery?
She does, yeah. You've sent them to
absolutely.
me in that circumstance, 100%.
Actually, just earlier today.
Yes, really? Yeah. So yeah, no, and that's why she's such a great asset to have here, is because she does know the difference. And there are patients that can be treated non-surgically, and there are patients that unfortunately surgery is the only thing that's going to give them the relief they're looking for.
Now, first of all, I'm the biggest baby walking the first of the year. I mean, believe me, okay. I get my blood pressure goes high when you touch my knee. I go, okay. But anyway. The fear, okay, we all have it, okay, and we're all apprehensive. But the fact that you have the experience that you bring, Tony, and what you have available here, it makes it a little bit more comforting. Am I right in saying that?
Yes, yeah, absolutely. Experience is key when it comes to surgical procedures or injection procedures. Experience is key when treating your patients, and it's such an integral part of medicine that you should always seek out experience.
Yeah, one thing you have, okay, I've told you that many times, and not because you're a very close friend of mine, but you have that the patients always appreciate the fact your bedside manners are excellent. You're not in a hurry. You're not trying to blow them off if there's a concern. Because sometimes the dumbest questions are very important to people. I mean, you may think I am, but you treat them really professionally, and I really got to applaud.
I appreciate that. We all do here, and we're very proud of that. Our patient satisfaction scores are very high.
Yeah.
And I think that's because everybody here is invested in our patients getting better, and that's critically important.
Before I wrap this up and bring Ashley on, what are some of the common conditions you treat?
So common conditions I treat will be osteoarthritis. I will treat folks who have chronic and acute tendinopathy. So those are going to be, tendon injuries, things of that nature. I see kids. So I do take care of our pediatric athletes, and especially if they have overuse injuries. Think about little league shoulder, little league elbow, things of that nature, and that's really a big part of my practice.
All right. So when your father has trouble with his arm, you said, "What should I do, Megan?" Right. So what should we be doing to keep our knees and hips, and any certain exercises, any kind of vitamins,
Oh man, if there was just one quick easy fix for all of it, we would all be doing it, right?
Megan, you got to tell me something.
So I will say, actually, there's really good evidence, if we're just talking about tendons, right? Yeah. Using tendons, not abusing them. So that means using our muscles, using them gently, not overworking them will actually keep them nice and stretchy, because we want them to stretch and be able to contract and everything appropriately. Not using them is kind of an issue. So think about if you hadn't used your shoulder in a while, then all of a sudden you go to pick up something really heavy. These tendons might just they may become injured.
No, happens many times.
And then when it comes to arthritis, if we're doing too much and we're abusing and pounding on our knees and on our hips, that's something that, again, over time, doing too much of it, the abuse part of it, may lead to earlier wear of the joints and lead you down the surgical path a little bit sooner.
What I can't understand, Megan and Tony, is when I'm seeing these people jogging, right, and they're in pain. They're really in pain. What are you doing that for? I think there's a certain thing that you could, they're doing. I say, come here. Are you nuts or what? I mean, you want to do, and my wife does that. She's a registered nurse, but she's a firm believer in what you just said, and she stretches, she does all that stuff, and I'll just say, that's good, honey. Yeah, all right, that's good. And I think that's all good too. Well, listen, I wish you the best. Okay, it's been a joy meeting you, and I'm sure you do well. Watch this guy. He's great. Tony, it's always nice seeing you.
Great to see you.
Keep up the good work, okay?
Thank you. Thank you.
Really appreciate it.
We're going to take a break. We're going to bring Ashley on after this, okay? Welcome back to the Sam Lesante Show, folks. We're here at 26 Station Circle, Lehigh Valley Health Network. It's right in the Humboldt Industrial Park. One of our health shows, and it's a great show, my friends. But once again, I want to thank you for making the Sam Lesante Show the #1 talk show in northeastern Pennsylvania. I appreciate it. And it's always a pleasure talking to the doctors and people who are affiliated with Lehigh Valley Health Network. Joining me now is Ashley Dalberto, and she's the outpatient rehabilitation manager, I would say.
Yep.
Yeah. You were on the show before, you said a while back.
A couple times with you, yeah.
So what do you do here, Ashley?
So here at Station Circle, we are in physical therapy and occupational therapy, mostly orthopedic based. We work closely with the doctors and their protocols to get the patients at their maximum potential, whether it be post-surgical, for pain. But we also do have our other locations over at the Hazleton Health and Wellness Center and at the Health Center at Mountaintop, where we see more chronic pain issues and other types of things, such as neurological imbalance.
How does this rehabilitation thing work with doctors like Dr. Falvello and Dr. Ferderber? I mean, how do these things work?
Yeah, we work very closely with them. Dr. Falvello, with his post-surgicals, we see patients pretty shortly after their surgery here in the clinic to follow any kind of protocol he wants set forth to get them to their prior level of function. And with Dr. Ferderber, we will see her patients after she does any kind of procedure or just for some pain management to get them back to activities that they may not have been able to participate in due to their pain. Okay, so a question is this. A person is being told by Dr. Falvello that, you know, we're doing a surgery, hip replacement, and he explains everything from A to Z, what's going to happen, and which is the patient's concerned about. Do you then explain to them what will happen after the surgery, and tell me about that? Yes, so sometimes we will see the patients 1 to 2 visits before their surgery to kind of prepare them. This is what to expect day of, this is what to expect when you go home, and here's what the exercise is going to look like afterwards.
Fabulous. Okay, so now you're doing occupation therapy and physical therapy. Okay, what's the difference between occupation therapy and physical therapy?
Yep, so occupational therapists, they're typically going to focus on injuries to the upper arm and elbow, forearm, hand, and fingers. So we will see a lot of post-surgical patients for the hand, and also injuries such as like tennis elbow or golfer's elbow for the forearm. That's more occupational therapy, and the physical therapy is sort of from shoulders down and the rest of the body.
So the physical therapy would be after the surgeries?
Yes.
So occupational therapy, I'm at work, and something happens, either sprain my back or something, my arm, or so then you could become specific to that particular need, correct?
Yes, so we also do what's called functional task training or work hardening programs with occupational therapy, where we have a description of your job and we will work on different tasks and activities that might be asked of you at your job in order to make sure that you're safe to go back.
That's great. Because I remember doing a show up at Health and Wellness Center, and we showed the different areas, okay, where someone was hurt at work and then they came in. Now, do you evaluate that, or does a doctor say this is what this person needs, and then you take it from there? How does that work?
Yeah, the doctor will always need to place a referral in order for a patient to be seen by a physical therapist or an occupational therapist. So it's usually a consult with your doctor.
So you need to see a doctor before you come to you. Okay,
Yep.
I can't just say, actually I'm having this, etc. You have to go to the doctor, and they in turn do that. What makes us unique?
Lehigh Valley, we are very patient-centered. We also work so closely with the physicians and the doctors within the network. We, especially in our Station Circle location, have the orthopedic doctors right here on site, where if there's a patient in our care and then we have a question or something comes up, we can easily walk right over and talk to the doctor. Sometimes the doctor can come right over and see the patient in the clinic, and I really think that makes us stand out from other larger health networks.
Now, let's talk about this fabulous space we're in, okay? We're at 26 Station Circle, which is in Humboldt Industrial Park. It's fabulous, you can get lost in this place, okay? I need a map when I come in. I call my GPS. I'm going to, all kidding aside, tell us why this is such a great opportunity for the community.
Yeah, this site here is centrally located to not only the town of Hazleton, but also in Humboldt and Industries and just a lot of the workplaces. So anybody who has a workplace injury can come right over to here right when they get out of work or on their way in, and it's just very conveniently located. You
have the passion for what you believe in. And that's important, isn't it? Yeah.
Absolutely.
Well, I wish you the best. Hope I never have to come to see you, other than say, hi, Ashley, how are you? It's Sam, But seriously, you do good work, okay?
Thank you.
And when you get the results, the patients say, we're very happy with the
Lehigh Valley. We have a great team.
Yeah. Well, good luck to you.
Thank you.
Remember, folks, 24/7 SSP TV. You watch all of our health shows, particularly with Lehigh Valley Health Network. We'll see you next time.